is intermittent fasting? That is definitely a topic that I'm getting more and more questions about from patients, because they've heard that a girlfriend did intermittent fasting and she lost weight, and they're reading online or on social media that this is the new way for longevity. And a lot of patients love the fact that it causes weight loss, so they definitely want to jump on board. But before doing it, you know how they always say, check with your provider. So patients call and ask, is intermittent fasting something I can do or should do? What do you think, doc? Okay, so welcome back. I'm Dr. Tinuade Olusegun, and this is Angelic Wellness, where we try to explain all things natural in terms of options to treat disease. We talk about hormone balancing here. We talk about lifestyle changes that help you deal with chronic diseases without necessarily using prescription medications. And today we're going to be addressing this topic about what is intermittent fasting, okay? So the name comes from the fact that we are fasting intermittently, right? Meaning like most patients usually will eat dinner and then maybe get a bedtime snack and then go to bed, right? And after that, they wake up, first thing is they're gonna prepare breakfast, eat lunch, eat dinner, snack in between, so on and so forth. So with intermittent fasting, what we're saying is that you need to give your body breaks, prolonged breaks, where the body is not eating anything, is not digesting anything, so that it can tap into the healing properties of the body. So you might have heard me talk about the fact that the body heals itself, right? It knows what to do. The DNA is programmed with what to do to heal. So when we remove the offending factors like the toxins and the injury and the bad choices, the body can heal. And one of the ways we can let the body heal faster is by giving it a break from digestion. So when the body is not digesting, guess where all that energy is going to go? It's going to go find the cells that have DNA damage and repair it. It's going to go find toxins and pull them out from where they're hiding and send them out of the body. It's going to have time to repair tissue that needs to rejuvenate and regenerate. It's going to have time to do all those things. But if you're constantly eating, the body doesn't have time to do those things. It's so busy trying to digest every few hours because you're eating every few hours, okay? So that's where the concept of fasting came from, intermittent fasting, where we are now saying, okay, after you've had dinner, say you had dinner around 6 p.m. or 7, you're not going to eat anything before bed, and then when you wake up, the first thing you're going to do is not eat, okay? You're not going to eat again. You're going to wait a little bit longer. So let's say you had dinner at 12, you go to sleep for a good 12 hours, just kidding. You sleep for 8 hours or so, you wake up, right? But you don't eat until 12, okay? So what has that done? Right, now you've had a good 12 hours or more where you haven't eaten anything, okay? And the body is able to heal and repair and detoxify and do all these things during those hours. But most notable is that the body goes into fat burn, because when it's doing all those detoxification and building or repairing of tissue and everything, it still needs energy. But because you're not eating, it forces it to tap into your fat stores, which is the energy source that the body had put away, saying, I'm going to use it later. So it actually lets the body go into those fat stores and start using it. Okay, so during intermittent fasting, the benefit is, yes, we're going to detoxify. We're going to be able to burn fat. We're going to have even more energy because now the body is making some ketones to try to get through that period where you're not eating anything. So those ketones are also great for the brain. The brain feels clearer, feels more energetic, can think better, brain fog is lifted, and it is very helpful for what we call autophagy, which means that the body is less inflamed, has more of the beneficial longevity features. Okay, so again, intermittent fasting very simply just means giving your body long periods in between meals that allow your body to do other things other than digestion. Okay, so we now have a small window where we get to eat. So for that patient that started eating at 12, they can now only eat between 12 and 6 p.m. So now they have a lot of hours where the body is not eating and digesting, for where it can start healing and repairing. Okay, hope that makes sense. If you have any questions about that, please mention it in the section below. Also, for those of you that are currently doing intermittent fasting, I would love to hear what experience you've had, what you've noted with symptoms, with improvement, or in sleep, whatever areas. I would love to hear what you have noticed. Okay, I'm going to do a part 2 to this video because I want to talk about diabetic patients that are now doing intermittent fasting. Okay, we need to talk about some risk factors and some important things that you need to look out for if you are a diabetic that is doing intermittent fasting. I'll see you on that video. Okay, talk to you soon. Bye.